Finance Committee will come to order. Today, the Finance Committee focuses its attention on what, in my view, is the biggest challenge ahead for Medicare and the future of America's healthcare system. That is managing chronic illness. To understand why this is a growing issue, one need only to look at how Medicare has changed over the years. When the Medicare program began, and in those early days, I was co-director of the Oregon Gray Panthers, had a full head of hair and rugged good looks. And Medicare was mostly about caring for seniors who needed to go to the hospital. If a senior slipped on the kitchen floor and broke an ankle, for example, they'd head to the hospital, they'd get treatment, and they'd head home. In 1970, nearly 70% of Medicare spending was for hospital care. Now that number is closer to 40%. The change shows how Medicare is very different than it was 4 decades ago. Rather than broken ankles or pneumonia, Medicare is now dominated by chronic conditions such as cancer, diabetes, and heart disease. More than 2/3 of those on Medicare now are dealing with challenging multiple chronic conditions. That care accounts for almost all, 93% of Medicare spending. And we're going to hear today that it is not just seniors who are affected by chronic illness. Half of all American adults have at least one chronic condition. These diseases account for 70% of deaths, limit the activities of tens of millions more Americans, and cost the economy billions each year. The problem is only going to be compounded as chronic illnesses become more common. In fact, there are a number of healthcare experts have warned that this generation could be the first in modern times to have shorter lifespans than their parents. And this is not just a health issue. The growing prevalence of chronic disease is also a major driver of healthcare costs that are putting a growing burden on the government, on business, and family budgets. Here's my bottom line. The way healthcare in America is delivered has got to change. And I'll repeat that. It has to change. Doctors and hospitals often don't coordinate care or even talk to one another. Patients receive medication for one disease that conflicts with another. Paper medical records force time and energy away from patient care only to be spent on burdensome red tape. There's even data showing that caregivers of those with chronic disease face higher rates of stress and depression and have higher mortality rates. Virtually all Americans get touched by these kinds of issues. And certainly those suffering with chronic disease are hurt the most by the flaws in American healthcare. This morning's hearing is going to look at the problems faced by millions of Americans every day as they try to navigate America's chaotic system of treating chronic illness. The committee is going to hear how the tragedy of chronic disease is exemplified by a single mom who, before her 31st birthday, had major heart surgery, can no longer work or even drive a car because of the onslaught of these diseases. We're going to hear about patients with multiple chronic conditions who are left on their own to shuttle themselves between a whole array of different providers that often are located hours away from each other. We're going to hear a story from a wife struggling to take care of a husband with Alzheimer's, trying to make sure that the doctor appointments are kept, medication is taken, and the marriage is intact. I think we all understand this is not something that is going to be solved overnight. This chronic care hearing marks the beginning of what will be a bipartisan effort to address the dominant problems in America's healthcare system that practically everyone over the last decade has managed to ignore. In the months ahead, the committee can find bipartisan solutions to meet the challenges and strengthen the American healthcare system. I'm very much committed to working with senators on both sides of the aisle, and let me recognize Senator Hatch.